So in pelvic floor therapy, we talk a lot about pressure management within our core system. Now, our core consists of our abdominals, our diaphragm or muscle of breathing, our pelvic floor, and our back stabilizers. All of those together help to manage pressure throughout the system. Now, the pelvic floor is also responsible for stability and has connections to the spine, and also support of the pelvic organs. We have our bladder, our uterus, if we still have one, in our rectum. And of course, these are not drawn to size, but these all sit within this cavity. And pressure mismanagement can lead to urinary symptoms, bowel dysfunction, core weakness, hernias, hemorrhoids, lots of different things. So the way that we describe it is if there's excessive or mismanaged pressure out into the abdominals, that may lead to a diastasis recti, or that abdominal wall separation. It may lead to a hernia. If we've ever had a C-section or really any other abdominal surgery that creates a lot of scar tissue within the abdominals, that's going to affect the core system and can be affecting our pelvic floor. So with regard to scar tissue, we always think about if I put on a really tight jacket, zipped it up, and I couldn't get out of it. That's what happens with scar tissue within our abdominal cavity or abdominal wall. We need to have good mobility there. If we have pressure that goes up into our diaphragm, we may have something like a hiatal hernia. We may be struggling with things like GERD or acid reflux. If we have pressure going out through our spine, again, we may have back pain. And then if we have pressure down on our pelvic floor, pelvic organs, we may have things like prolapse, again, urinary and or bowel dysfunction like incontinence, for example. We may have hemorrhoids. There's lots of different things that can occur when these systems are not working well together. So it's really important to understand the concept of breathing, to understand the concept of posture, and how it relates to the function of all of these things working together. Because if we only work on the abdominals, we're hitting 25% of the system. If we work on our abdominals and our back, we're hitting 50% of the system. So we really need to consider what's going on with the abdominals, what's going on with the diaphragm, what's going on with the back, and most importantly, what's going on with the pelvic floor, so that we're able to address each and every part of that core canister or pressure system to help alleviate symptoms of any one or multiple of these diagnoses.